Over 2 million Americans are alive today because of implantable electrical therapy or devices such as the pacemaker. A pacemaker is about the size of a $half piece that is placed under the skin near one's heart to control the heartbeat. A pacemaker can often be implanted in one's chest with a minor surgery. Pacemakers are primarily placed into patients that have heart arrhythmias in which the heart's rhythm is abnormal. Normal aging of the heart might disrupt the heart rate, making it beat too slow. Patients that have suffered from a heart attack may also have disruptions to their heartbeat. Some medications or genetic conditions could potentially cause an abnormal heart rate too. Pacemakers can be implemented temporarily to treat a slow heartbeat after a heart attack, surgery, or overdose of a medication. They can also be implemented permanently to correct a slow heartbeat or even in some cases, heart failure. A pacemaker is an implanted electronic pump that mimics the actions of one's natural pacemaker. An implanted pacemaker consists of two different parts, the pulse generator and the electrodes. The pulse generator is a small metal container that is composed of a battery and the electrical circuitry that regulates the rate of electrical pulses that is sent to the heart. Electrodes are each placed in a chamber of one's heart and deliver the electrical pulses to adjust one's heartbeat. Pacemakers monitor one's heart, and if it is too slow, the pacemaker will speed up the heart rate by sending electrical signals to the heart. When one exercises, the pacemaker has sensors that detect body motion or breathing rate. As a result, this signals the pacemaker to increase one's heart rate during exercise to meet the increased demand for blood and oxygen. There are three types of pacemakers: the single chamber, dual chamber, and biventricular. A single chamber pacemaker usually carries electrical impulses from the pulse generator to the right ventricle of one's heart. The dual chamber pacemaker also carries electrical impulses from the pulse generator to both the right ventricle and the right atrium of one's heart. The impulses control the timing of contractions between the two chambers. Biventricular pacemakers are a treatment option for people with heart failure whose heart's electrical systems have been damaged. This particular type of pacemaker allows your heart to pump blood more efficiently. A pacemaker's battery life is expected to last 5 to 10 years. Once the battery is dead, another procedure is done to replace the battery for a new one. The procedure to replace the battery is quicker and takes less time for recovery than the original procedure. By pacemakers preventing a slow heart rate, they can treat symptoms such as fatigue, lightheadedness, and fainting. Because most of today's pacemakers automatically adjust your heart rate to match your level of physical activity, they can allow you to resume a more active lifestyle.